So as we've done before, we're just going to take a slightly more granular look, not terribly so, but a slightly more kind of detailed look at the concept of wedge, because we've done a general video on lever, wedge, screw where we describe each of these concepts, and we've done a video on just how to combine long lever, short lever to create mixed lever, concept of relational motion. But here what we're going to do is we're just going to look at the concept of wedge a little bit deeper in a few varying areas. So you have the explicit opportunity to see these things again. You may come up with these on your own, you may see them other places, but it doesn't hurt to have it repeated such that maybe the message is correct in one location, but the messenger may not be the right one for you. Even in this case, I may not be the right messenger, but we're going to take a look at it. So essentially we talk about a wedge. It's a portable inclined plane that is used to kind of separate things, basically. It's considered a simple machine, but in the case of actual hands-on therapeutics, it doesn't necessarily work out that way. It can in some circumstances, but the basic idea is you're trying to separate things. So you're trying to put something in between things to help separate them. And the classic place that we see this, and this won't be perfectly demonstrated here in the video, but if we think about the ribs and the line of the ribs, I'd use my hands and I'll kind of come to the ventral portion. Although it's not ideal in this case because of the angle of the shot, and I get that. But basically what you're going to see is you're going to see people hold in between intercostal spaces, right? So they're going to hold the rib below down, and then, so that's kind of the wedging force. You can kind of push straight in a short lever sense to try to separate them. So you can push straight in with whatever piece of your hand or configuration of your hand that works well, or you can hold an area. Again, you won't see this particularly well. My hand's basically like this in an intercostal space, and then you use kind of a mixed leverage approach. So I've got my long lever, my short lever down here. It's a mixed leverage approach. So again, I understand that you can't completely see it, but I'd be more or less tracing an intercostal space, holding it, and then using the patient's arm. So that's one place where we can see a wedge. Another place where we can see a wedge, just let's consider that the elbow doesn't like to extend all the way. Well, what we can do to wedge them apart, to wedge the surfaces apart, and also essentially kind of pull the backside of the elbow apart, so in and around the olecranon, right? So if I just have the elbow up here, and I put my hand in between the humerus and the forearm, more or less, right on the front of the elbow, this becomes a wedge, right? So as I pull this, usually it would just close, right? It would just close. If I put my hand in between, what it does is it acts as a wedge. So it actually pulls the backside of the elbow apart. So we've got a wedging force there, right? Similarly, if the superior portion of the humerus is kind of stuck close in, or the arm doesn't like to come out, what we can do is we can, again, and this may not look perfect, but we go into the armpit. You can put your hand into the armpit, you can pull a pillow into the armpit, and as you bring them together, it creates a separational force at the glenohumeral joint. You can look at this in between the fingers, right? So if the fingers are not separating particularly well, you can put your finger in between and then bring them together. Sometimes you'll have to figure out the most appropriate kind of orientation, but if you put something in between things again and you bring them together, it creates a wedging force, it creates a separational force. So as I bring, usually this all approximates if I just do this, but if I put my finger in between as a wedge, when I bring the top end of the fingers together, the bottom end, closer to the metacarpal phalangeal joints, we get a separation in between, right? So we're using it almost like a crowbar. A similar example would be in the knee. So if the knee needed to be worked on, right? So if the knee essentially didn't like to move as smoothly, we can also, again, use a wedge here. Just use my other arm, use a wedge here, right? Stand up just to get a slightly better hold. But what I can do is, by putting the wedge, I open this more. I separate these surfaces a little bit better, right? So the idea of the wedge isn't applicable in a ton of places in the body. However, it can be done especially on larger joints or on joints that have the ability to get in between surfaces. The ribs are a consistent example. Many people will speak about wedging ribs apart. We can speak about wedging a knee apart. We can speak about wedging fingers, wedging the elbow, and wedging in and around the shoulder. It doesn't work particularly well in any other area, just because we have a harder time actually creating an appropriate wedging force. The concept can be applied in some ways. The other thing, anywhere you essentially have a fixed point, right? You have a hand that's still, and you have it spanning two joint surfaces, or the two bones that make up a joint. At some point, you may be able to create almost a very, very minor hook, right? You can hook onto the surface and create a short lever pull. That's not truly a wedge, but many people will speak about it in the concept of a wedge. Again, we're just basically finding places where we can insert some form of firm handhold, forearm, whatever it is, sometimes a towel, sometimes a pillow, and approximate surfaces to essentially gap the other side or create a separational strain on the opposing side of the joint.